Welcome to Understanding Human Anatomy. In this video, I want to discuss the knee joint. And I'm going to start by drawing in the distal end of the femur. We'll start by drawing a shaft and have it widen out to form a lateral condyle, the intercondylar notch, and then a medial condyle, and then on the medial condyle we'll have the adductor tubercle, like so. Then we'll draw in the tibia, and the tibia has a lateral condyle, the intercondylar eminence, and then a medial condyle. And we come down to form the shaft of the tibia, and over here on the lateral side likewise. And remember that the tibia is a triangular bone, so I'll have a ridge anteriorly, and we get a ridge coming from each of the condyles, and then we'll have a raised area, the tibial tuberosity. And lastly, we'll draw in the fibula, or the head of the fibula, and remember that the fibula articulates with the tibia. And you'll notice in this diagram I've left a substantial amount of space between the tibia and femur. And I want to fill in that space right now, and I'm going to draw in a spacer that will be the meniscus on each side. So we have a lateral meniscus and a medial meniscus, and what I'm going to do is color these in a light blue because they are a different type of tissue. The menisci are composed of fibrocartilage. Now, with the menisci, we have a complex joint. All joints that have a meniscus between the two articulating bones are referred to as a complex joint. And the knee is the best example of this type of joint. So the femur doesn't articulate directly with the tibia. The femur articulates with the two menisci, and then the two menisci articulate with the tibia. Let me add labels to this diagram. We have the femur, and on the femur we have the adductor tubercle, we have the medial condyle, We have the medial epicondyle. We have the medial meniscus. We have the medial condyle of the tibia. We have the intercondylar eminence. We have the tibial tuberosity. We have the lateral condyle of the femur. We have the intercondylar fossa. We have the lateral epicondyle. We have the lateral meniscus. We have the lateral condyle of the tibia. And we have the head of the fibula. Now, when you're looking at a diagram such as this, it's isolated on a joint where you don't see the entirety of the bones forming the joint. It's sometimes easy to get disoriented as to medial and lateral. And when we're dealing with the knee joint, remember that the fibula is always lateral. So where we have the fibula here, we have the lateral side of the joint. And on the medial side, the main landmark is the adductor tubercle. That tells us that's the medial side of the joint. So this side is the medial side. Always look for these kinds of landmarks to help you distinguish medial from lateral. Now, I want to discuss the joint and the ligaments within the joint. So in order to do that, I'm going to erase the labels so that I have room to draw in the new structures. Now, the knee joint is supported by several ligaments. The first one I'm going to draw in is here on the medial side. And this is the medial collateral ligament. And there is a companion ligament on the lateral side, which comes down to the tibia and to the fibula. And this would be the lateral collateral ligament. In addition, we have ligaments between the tibia and fibula that holds those two bones together at the proximals of the joint. So the medial and lateral collateral ligaments keep the bones together and resist pressure from the lateral and the medial side. Pressure from the lateral side would try and stretch the medial ligament, and it prevents separation of the two bones on the medial side. Likewise, pressure on the medial side of the joint would tend to cause the lateral condyles to separate, and the lateral collateral ligament prevents that. In addition, if you're stepping from the side, athletes often do this when they're changing direction. They push off, and as they do that, they put pressure on the bones to separate on their lateral side. So the lateral collateral ligament prevents the bones from separating and the joint from coming apart when there's a sudden change of direction like that. Now, one of the key features of the knee joint are the cruciate ligaments. And the cruciate ligaments run from the tibia to the fibula through the intercondylar fossa. And they will take origin from the intercondylar eminence on the tibia and pass to the femur. Two ligaments. The first one I'll draw in is the anterior cruciate ligament. And it originates on the anterior side of the tibia and passes posteriorly to attach to the femur in the posterior portion of the intercondylar fossa. Now, the other cruciate ligament I can only show you a little bit of, and that is the posterior cruciate ligament. And the posterior cruciate ligament takes origin on the posterior side of the intercondylar eminence of the tibia and then passes through the intercondylar fossa to attach anteriorly on the femur. And I chose a different color. I chose orange for the posterior cruciate ligament And I've done that just so we can differentiate from the anterior cruciate ligament. So let me add some labels to the diagram. The medial collateral ligament, often abbreviated MCL. The lateral collateral ligament. Often abbreviated LCL. The proximal tibiofibular ligament. And then the two cruciate ligaments. And of course they're named cruciate because when you view them from the side, they form a cross. So we have the anterior cruciate ligament, and we can just see a bit in the diagram the posterior and again I've shown that in orange, and we can just see the little bit of the anterior cruciate ligament sticking out here as it attaches to the femur. So these are the primary ligaments of the knee joint. This is a good place to stop our discussion of the knee joint, and in the next video we'll complete our discussion of the knee joint by adding in the patella and then taking a closer look at the anterior and posterior cruciate ligaments. Thank you for your attention.